Question number 1. Do you prefer to use custom abutment than prefabricated abutment? If so, why?
I have been in practice for about 18 years, and for the first 15 years, I only used prefabricated abutment. However, for the past 3 years or so, I have been using custom abutment only. The reason is that I received many questions about the differences between the two abutments during my lectures. So I decided to experience more with custom abutment in my clinic. There are many good advantages to use a custom abutment, but I found it inconvenient to have one more step to check with abutment fitness. However, I consistently try to overcome the fitness issue with many different ways. I was able to find the solution that I shared in today's lecture. Even now, I'm using custom abutments only.
Thank you for answering that. Question number 2. Between the modeless way and the model way treatment, which treatment approach do you prefer?
I prefer model treatment with the method that I had introduced in today's lecture.
Okay, question number 3. Do you rescan after connecting custom abutment into patient's mouth?
I had the same answer just as the second question. Since I do model treatment, I can overcome the fitness error prior to a patient visit. Using a jig is the solution.
I see. Question number 4. How do you scan the shiny surface, such as abutment?
I make the abutment ready with surface treated. The upper part of the body is sandblasted and the lower part of the body is polished. Actually, it isn't hard to scan because I scan the abutment separately outside of the oral cavity and make it aligned later on. In a case when there is a shiny surface, I recommend you to use a scan spray.
Okay, thank you for answering all the questions today. Okay, that's all about it for today. You'll be able to watch this webinar on our YouTube channel and Medit Academy. And we would appreciate your feedback. And if you have any questions, then contact us meditedu@medit.com. Thank you for being here, Dr. Kim.
Thanks everyone for joining us today. I will come back with more interesting and useful topics next time. See you in the next webinar. Bye.
Bye.